Good day, sir. My name is Christine Zaria D. Bueno, Bachelor of Science in Nursing, second year at Calayan Educational Foundation. I am here today to show to you the proper donning of personal protective equipments, and here are the materials needed. Hand sanitizer or alcohol-based hand rub. Next is fluid-resistant coverall and plastic apron, boots cover, 3 pairs of sterile gloves. One is the exact size of your hand. Next is one size larger, and the other one is during patient care if needed. N95 mask. For eye protection, we will use goggles and face shields. We will also be needing 1:10 bleach solution. So here are the actual pictures of the materials to be used. Let's now proceed on proper donning of PPE. First, ensure that the trained observer is available to verify compliance. Next, ensure that all supplies are available. And then after that, prepare yourself in donning PPE. Wear plastic or rubber boots. Remove watch, jewelry, and pocket contents. Secure your hair. Inspect if the PPEs are all in good conditions. Make sure of the sizes are exact. Put on boot covers and perform hand washing. After doing hand washing, put alcohol-based hand rub and wait until it dries. Put on inner gloves. Make sure that it is sterile. And then, wear coverall gown. Make a thumb hole on the border of the cuff and sleeves. Put on N95 respirator. Next, put on hood. Put on outer apron. Put on outer gloves. And put on goggles or face shields. That's all in donning personal protective equipment. Doffing PPE. PPE should be taken off in a PPE removal area. PPE should be put in a leaked bag of infectious waste. Doff PPE only with the supervision of trained observer. Single use of disposable face shield and face mask is advisable. Coverall or a single-use fluid-resistant gown must extend below the knee. Minimize touching the healthcare worker or his or her PPE. And if there is a contact between the healthcare workers, the outer gloves must be disinfected by the trained observer. Before removing PPE, we must inspect first for the contamination or tear from the personal protective equipment worn by the healthcare workers. In case of visible contamination, use 1:10 bleach solution and wipe it off. Disinfect the outer gloves and remove the apron. In removing the apron, we must pull it to the front and roll it inside out. Inspect again PPE and disinfect the outer gloves. Remove boot covers and touch it only on the inner surface of the boot covers. Disinfect the outer gloves and remove the outer gloves. Inspect inner gloves and disinfect inner gloves. Remove goggles, lift back the strap, and avoid touching the goggles in the front. Disinfect the gloves and remove the hood. Disinfect gloves and remove coverall. Avoid contact of the scrub into the outer surface of the coverall. After we remove the coverall, we must roll it inside out not to spread the microorganisms. Disinfect inner gloves and remove gloves. Put on new pair of gloves and remove the N95 respirator. Disinfect gloves and disinfect washable boots downward. Do hand washing before removing the inner gloves. Disinfect first, and after disinfecting, remove it, not touching the contaminated area but the sterile area, and after that, do the hand washing. Inspect for contamination.